Okay, so first of all, I usually use the word delayed conception, because I
Yeah.
think that the word infertility, although it's right up there, but it's got a very negative, vibe to it.
Hi, my name's Yudishtra, and this is my wife Piya. We're a husband and wife podcast.
Today's episode is one that is very close to my heart, and we are joined by today with our guest who has played a very meaningful role in our own personal journey, Dr. Eeson Sinthamoney. Dr. Eason is a consultant gynecologist, fertility specialist, and medical director at Sunfert International Fertility Centre in Bangsar South, Kuala Lumpur. We first knew about him from a family member of ours who went through their own journey of conceiving a child. And Dr. Eason was the doctor who handled their particular journey. Once we heard from them, when we heard their journey and their story, we wanted to meet with Dr. Eason ourselves personally. I still remember when we came out of the consultation room after seeing Dr. Eason for the first time. I remember turning to my husband and telling him that if we were to go down the path and if we have to go through this journey, I would want Dr. Eason to be my doctor. We're incredibly grateful today that he has agreed to come on our podcast to share with all our listeners a little bit more about what happens behind the scenes, the emotional layers of the fertility journey, and what a couple goes through in the pursuit of parenthood. Without further ado, we welcome Dr. Eeson Sinthamoney.
Thank you guys for the kind invite. It's a pleasure to be here. It's a pleasure to be talking to you guys. If only I get to meet guys like you on a daily basis, then my life becomes much easier because you guys are obviously young, bright, and understand a lot of things about how our work works. I wish it was the same for everybody, but it isn't. And therein lies the challenge, our everyday challenge. Helping to fix problems, helping them to understand problems. And I think the most challenging of all, managing expectations.
Wow. Dr. Eason, I want to say thank you so much for taking the time to be here today. As my wife was saying, we're truly honored to have you on our podcast today.
Pleasure is all mine.
Thank you. So let's jump in. I think it's going to be a fun hour that we're going to speak about. So let's start off with the first thing would be, so doctor, what actually drew you to fertility medicine, and specifically in this very intimate part of people's lives?
Okay, so I I know that the path that you choose in life is sometimes determined by yourself. Sometimes it is not determined by yourselves. Whether you believe it or not, I think there's a component. It doesn't matter what you do, whether you do medicine or you become a pilot, or whether you do engineering or law or whatever it is that you do. Bit of it is destiny, and some of it may be driven by yourself. We can argue till the cows come home about whether how it's entwined and so on and so forth. But anyway, so I think very early in my life, I decided to do medicine, and strangely enough, at that very early part in my life, I was told that you would go down this path of delivering babies and so on.
Wow.
Oh, wow.
Even
And
before
I
you
thought-
chose the...
Yeah, so I thought, so I mean, today looking back, I wonder whether is that destiny or is that your mind just following what you've been told?
Okay.
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 So that's been a question that I've asked. But anyway, it is what it is. And I said, I once asked my mother, who I said, what if I don't want to do ops and gynae? What if I choose to do general medicine or become a physician or a pediatrician? He says, you can, but perhaps you wouldn't be as successful. And that kind of stuck in my head, that you can choose parallel path,
Yeah.
but it may not be the correct choice.
Yeah.
If you believe that it's not quite what was chosen. So that's interesting. And I remember this because I keep telling people, even today, I tell my juniors today that sometimes the door on your left is open. You keep knocking on the right door and you wonder why the door doesn't open. But actually the door on the left has been open for the longest time. Yeah. So as I was coming down that road, and then one day, in pre-med, we were asked to do a project, and we were given a few titles. There were about 8 or 9 titles, and one of them was in vitro fertilization. So this is like
Okay.
3 years or 4 years. Oh, hang on, sorry, it wasn't. It was about 10 years.
Okay.
10 years after the first IVF baby was born. So I thought this looks interesting. And it was, something, was medical based. Some of the others were not medical based. And I thought I'll do this. And and in those days there was no internet, so you couldn't go to Google and punch in IVF and get 1,500 hits.
Yes.
You actually had to go to the library and you had to look for articles that were related. So there was a lot of searching. And believe it or not, before your time, Time magazine was actually compiled and kept in the library.
Oh, Time
Wow.
magazine.
I know it's mind-boggling. Younger people today will go like, "What is Time magazine?"
Yeah.
Okay, I know my daughter would. What is Time magazine? But yes, so Time magazine was compiled year into year, and there was hard covered, and you actually went and you hunted this down. So I did a nice paper on IVF. And this was and I think the reason why they came up with this topic was 10th year anniversary of the first
Okay.
IVF baby. So first IVF baby was born in 1978.
Wow.
So this was this would have been 88. So that was when I became interested. Yeah. So it's a long way off. One of my juniors who was in school with me, went to medical school with me, and who's now a fetal medicine specialist. When he first heard I was doing IVF, and he looked at me and he said, "Oh my God, all those years ago, you said you wanted to do IVF. I didn't think it would.
And then it actually,
I didn't think you'd actually follow through.
Wow.
Yeah. So it's just a part.
Like talking about like the fertility journey and everything, right? So we've spoken to so we recently in our previous episodes on our podcast, we actually opened up about our own personal journey, and I was quite surprised that a lot of people actually reached out to me on social media to then ask me that, we were going through this ourselves. And I was quite surprised because it's something that people didn't want to talk about. But at the same time, I realized then there were so many people silently, in a way, struggling with this problem. What is the biggest misconception that you have seen in the area of infertility?
Sure. So infertility. Okay. So first of all, I usually use the word delayed conception, because I think that the word infertility, although it's right up there, but it's got a very negative, vibe to it. Perhaps due to bad publicity over the years. But delayed conception, I think, is a more politically correct terminology. But it means the same thing. Do I think there's a psychological component to it? Maybe, but it's primarily physiological. It's primarily physiological. The psychological component is secondary. So there's a delay, and then you get upset about the delay, and then things spiral from there. Okay? But the delay at the beginning, the primary delay was not psychological, it's physiological. Something didn't work, or something hasn't worked yet. That's it. Okay? That's all. So, fortunately today in 2025, people are far more open about this. Okay? I mean, can you imagine, 15, 20 years ago, it was far, far worse. People were not so accepting. It was still it was far more negative. And because it was negative, people were so much less keen to talk about this.
Or even get help.
Or
from
get
that
help.
effect.
And if you can't talk about it, then the less likely that you're going to reach out for help. But fortunately, in 2025, people are far more open and far more willing to talk about it. And if I dare say, much more normalized. Okay, this is like it's normalized to the point that people would be quite happy to say that or be quite comfortable to admit that there's a delay, as they would be comfortable admitting that they have maybe a blood pressure issue or diabetes.
Yeah.
You wouldn't be upset. Tell a friend that, I've been told that I have early diabetes. What's the worst that can happen? They'll probably say, oh, so young and you got diabetes, or so they're a bit more comfortable, and I think that's a win. It's a win because now we can talk about it more openly, and we can discuss. Because if you are unable to admit that there's a delay, you can bet your bottom dollar they are not willing to admit to reach out for help, and the entire process gets delayed. So that's one perception, being more the perception that the whole problem is now accepted, that it's not such a big thing. Okay, then of course the other concern is between the couple is the blame game. Whose fault? I mean, I even see that even today. People coming, and then you can sense from the way the questions being asked. Like today I had somebody come in and said, doctor, the other day you looked at the sperm test and you said that it was fine, but my other doctor said that there's a problem with the morphology. So then I know that someone's been talking about this, and I know that it's been covered. So I said, yeah, okay, let's talk about this. So I said, come, let's have a look at the report. I said, okay, the reason I said it was fine is because the count's fine, motility is fine, the morphology is a bit less, but you got to look at context. I got to look at context. Do I think this is a problem? Okay, I don't think this is an issue. I think it's all right because the counts are fine, the motility is fine, and therefore I wouldn't think much about this. Okay, and then just to cement that, I would say that, do I think that this is the reason why you are here? I don't think so. And that drives the point back home.
Yeah.
But she's asking the question.
That's so it.
She's asking the question. So,
Conversation's
say,
probably-
so she's asking the question. So I said, so in other words, she's trying to say, are you sure it's not him?
Yeah.
That's the kind of thing, then you've got the other side, where they say like, oh, the other day you were saying that, so you can still sense that there is this little bit of, like, hey, make sure you say that it's not me, But 40% of the time, you don't even know what's going.
yeah.
I mean, it's unexplained.
Explained, yeah.
It's unexplained. So that's the other issue. The fact that in the past it was not accepted, and then now that fear that maybe like, am I going to get pinned for this? Is he going to turn around, or is she going to turn around and say that that's the reason why you're here? So those are the big things.
And I guess like being in that position, you probably also have to be like really careful.
Yes.
Like how, because I guess
Absolutely.
when they hit home,
Yes.
yeah. So I think
So the two big things that we got to drive back home from the very onset is trying to, first of all, let them know that both parties may well be involved. Okay, even if you do find something that's quite obvious. And then, of course, the other thing is that you got to drive home the fact that most of them can be helped. It's only a question of how willing are we to push that agenda, and how far we are willing to push it.
Okay. I think it's very interesting what you were talking about, because I mean, even for me, an example, I'm also in the process. I mean, also educating my parents also a little bit about, I guess,
But educating parents can be difficult, because parents being parents, and they come from a different generation, and they, unfortunately, many of them have the same mentality that, oh, we didn't have problems. I don't see why, I don't really see. No, I don't worry about it. You just, you guys just carry on. There's nothing wrong with that. I mean, I think that's encouraging, and it sort of, but my fear is that if you go on doing that for long enough, then you lose a lot of time. So by all means encourage, and say like, it's just like a kid at home,
Yeah.
I mean, like, if it's a kid that's not like my daughter, but a kid like who's into exams and
Yeah.
oh my god, I didn't get number one or whatever it is.
Yeah.
But although nowadays you don't even have number one anymore. There's no more, not like in yesteryear. There's no more class position and blah blah blah. There's no such thing. But if there was, and if your kid was one of those who was upset about not being somewhere there, then you sort of say, oh, don't worry about it, and you take your time. I'm sure you'll find your own space, blah blah blah. But if you don't, if you keep, saying that, then there's a risk that time will be lost, and the next thing you know, our friend is sitting in the bottom of the class and say, "But you said it was all right."
No, exactly. No, it's a
But you
numbers
said it
game.
was all right.
Yeah.
Yes, So that's the fear that we have, right? So the same thing. If parents encourage, it's fine. Don't worry, don't worry, try, and everything's fine. But they need to recognize that after a given point of time, if things don't work out, then say, guys, I think maybe you need a bit of help.
Yeah.
Hmm.
Then that's fine.
Yeah.
And correct me if I'm wrong, in this entire journey, like time is like really the
Yes.
most important thing, right?
Absolutely.
Yeah.
Absolutely. The time is the biggest challenge.
Yeah.
Time is the biggest challenge. So obviously somebody coming in at 30, and who's, but I must say this, coming in at a younger age, I mean, you don't get any, you rarely get anyone coming at 30 anyway.
We did.
So it's a rarity. It's a rarity. So somebody coming in at 30, with egg numbers appropriate for 30, you've got so much of time. You've got so much of time. But that's, of course, seeing it purely from a biological point of view. That's not at all looking at it from a social point of view.
Yeah.
Okay, because they will have other issues. I mean, they've got other items on the agenda. Like
Yes.
career and buying a house and parents and pressure from in-laws and not to mention the questions that you keep getting asked, the same old questions over and over again. And but look on the bright side. If people ask questions, it means they still think that there's hope. Because believe me, at a certain point, I mean, if you've been trying for X number of years and you're now 40 something, they stop asking.
Yeah.
Yeah.
They stop asking, and when they stop asking means that not happy.
I just want to ask you, I mean, is there a case or a moment in your career that fundamentally changed the way you practice medicine?
No, there wasn't a single episode that changed, that made a fundamental change to the way I practice medicine. But I will tell you that we learn as we, even having, I mean, I passed out 30 years ago, 30 years ago. And until today, I still learn things. I still learn things. I still see things that make me change some of the ways I do things. And if I can give you an example, you know how sometimes even outside of fertility, when I used to do deliveries, general obstetrics, so you watch mothers, they come in when they're pregnant and you monitor their pregnancy and you take them all the way down the road until delivery. It's good fun. And along the way, you may get somebody that's diagnosed with having a genetic abnormality. The pregnancy is diagnosed to have an issue. And then you say, oh, you need to see somebody to talk to you about this, what the abnormality is, what to expect, what can happen, should you decide to proceed with that pregnancy, okay? And so that you make an informed decision. And then you draw the line. Fine, she's been counseled, she's spoken to somebody, she's decided to keep the baby, blah, 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 and you're comfortable. But perhaps now I may have reached a point where I work even harder to make sure that they speak to more than one person. Because I've come to realize, although I should have realized this even then, that it's not just the parents that will pay the price of a mistake. I'll give you an example. If the pregnancy has been diagnosed with an issue, some abnormality. So obviously they'll want to know, right? What kind of abnormality is this? What are the implications of this abnormality? What am I looking at after birth? What will my baby be able to do or not be able to do? And that's difficult to even predict, right? So you got to point them at the right direction and say, go and speak to these kind of people who know more about these kind of abnormalities, blah, blah, blah. And they can give you some information as to what to expect. And then having spoken, speak to somebody else. Because I've come to realize it's not just the parents who will pay the price, and of course the child, but it's actually a 2-generational thing.
Why
Is it 2 generations?
Yeah.
Because you can do as much as you can do for that child, to take care of that child
While you're alive.
while you're around. But there will come a point that you will not be. And there will need to be somebody around, take care of that. And I think that that's one example of how that realization came upon me, and it sort of colored the way in which I deal with this kind of issues. So like this, so we come across, every now and then, something that tells us, hey, maybe we should turn a little bit and pay a bit more attention in that direction. So I think it's an aging thing, isn't it? Yeah. So I mean, there was no one single thing that happened that you saw something that said, but yet it's little small episodes that happen in your life that teach you things.
So when we talk about like infertility, just coming back to like earlier when we talked a little bit about the blame game, right? So infertility, oftentimes when we talk about it, it's often viewed, what I've noticed is that it's often seen as a female problem, a women's problem. But in nowadays, like of course, a lot of men are talking about it as well. But in your position, like you speak to both men and women, I think they walk into the room together. What are some of the issues that, from a male perspective, that probably they wish more people knew about? Because it's often seen as a women's problem. So women get a lot of support. Like we talked about this as well. Like so whenever we are at family events and stuff, people will come up to me more like, oh, is everything okay? That sort of thing. But like Yudish always wonders like, okay, but hello, I'm here. Somebody see me. Yeah.
Sure.
So how
So I
is
think that, you're right. You're absolutely right. And I think that if there's one thing that people should realize with regards to infertility, delayed conception, is that it's very much a man thing as well. And I think that on one hand, it's fortunate that realization has dawned upon them. Okay? It has. It's definitely been a shift over the last 20 years that more guys are realizing that it could well be a male factor, and some of them come on their own prior to bringing their wife in. It's becoming more common. And then you go like, so why are you here? I said, I came to do a sperm test. And I said, are you here alone? He says, yes. And I said, out of curiosity, why is it that you have chosen to come and do a sperm test? I just want to make sure that I'm okay. Before going down that, the common route. So that realization is there.
Okay.
So I think in that sense, it's a winning battle. Okay, people have started to realize in a big way that male factor is real, and male factor is not insignificant. It is not insignificant. What we normally tell our patients is that if you're looking at male, female, blah, 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 is one third, one third, one third.
Okay.
One third purely female, one third purely male, and one third combined. Where there are issues on both sides,
Yeah.
and that leads to issues. So you can have a mild male issue and then a mild female issue, but in combination leads to a delay. So in other words, if you removed one of them from the equation, this problem may not have happened. So for example, if the sperm were fine, but she had a mild issue, they may have gotten away. Or if she was having an issue, but or the other way around, if he had an issue, but she was okay, then they might have gotten okay. But instead, because both parties had small issues, collectively it became a big issue. So one third, one third, one third. Okay. So in other words, if you looked at the male contribution to the problem, up to half, 50%. Okay. But I think it's important to also be able to make that diagnosis.
Yes.
Because as I would have told a lot of people, I mean, I think if you're going to just look at a sperm test like this morning, and said, oh, their morphology is 1%, that's the reason why you're here, then life becomes a bit too easy. You start blaming everything on that thing, and you say, oh, you're going to have to go do IVF. It's a bit, it's unfair. It's wrong and it's unfair. So that I think is important. So the good news is that they've realized, but it is very, very common.
I mean, I'm going to ask a controversial question. Who takes it harder? When a couple actually has a fertility issue, in your experience, who actually takes it harder? Like the women, probably the physical side, I can see. You're going through all the meds and the injection, but the helplessness on the male side, what's your experience, doctor?
I think they both I think both partners could potentially take it equally badly. Okay, if you are told clearly that it's a male factor, then I think some take it okay, some don't take it well, and then if it's vice versa, if you can clearly point out that it's likely to be on the female side, then the same thing applies. Some of them take it in their stride, some of them don't take it so well. So sometimes when you tell them that if they fall under the unexplained category, then that's quite interesting, because then you can see that the positive of the diagnosis is that it diffuses that tension.
You can't blame anyone.
So that's the positive of the diagnosis, that it diffuses the tension, and that in a big way helps. The negative of the diagnosis is that there's a whole bunch of people out there, engineers are the worst, okay, that have difficulty with the diagnosis.
Yeah, how can something be not wrong?
How can you not know? Okay, and in medicine, unfortunately, this is a common problem, not just for fertility. I mean, not just for fertility. What's the most common cause of high blood pressure? It's called essential hypertension. Don't know. It's unknown.
Yeah.
It's called essential hypertension, which is the most common cause. If you have an older person who's got high blood pressure, like a parent or a grandparent who's got hypertension or got high blood pressure, you can bet your bottom dollar that it's essential hypertension, and it's of unknown cause. There's a genetic component to it, but bottom line, what's causing it?
Yeah.
I mean, a lot of possibilities, hardening of the blood vessels, blah, blah, blah. Yes, but it's essential hypertension. Okay, as in contrast to secondary hypertension, which is known to be due to something else. Okay, so the same. So there's so many examples out there of unknown cause. What causes cancer?
Unknown.
I mean, somebody who gets lung cancer who smokes 20 cigarettes a day, then we can pin it on the cigarette.
Yeah.
But if it's not, then what? So there's a lot of things in medicine that are of unknown or unseen etiology. And unfortunately, in infertility, 40% of the time, it's this. And getting them to wrap their heads around this concept that, listen here, it's an unseen thing. There's definitely something going on, but you can't see what it is. and then but you can still move on. So getting that concept, is a challenge.
Yeah, I can imagine.
It's a challenge.
Yeah.